This is my presentation on achondroplasia. My name is Tanisha Tawayet. So, etiology, what is achondroplasia? It is a genetic disorder that causes dwarfism, so otherwise known as dwarfism. It is characterized by short limbs and an enlarged head, causing an abnormal growth of spine and skull. So, people with achondroplasia, the problem is not forming cartilage, but converting it into bone. So this is the process of that is called ossification. It's particularly in the long bones of the arms and legs. The rare genetic disorders cause problems with development in the cartilage, the bone, and the connective tissues. This is a baby with a large head with a prominent forehead. So this is a baby that was born with dwarfism. It is by inherited by an autosomal dominant trait, meaning if a child gets the defective gene from one parent, the child will have the disorder. If one parent has it, then the infant has 50% chance of inheriting it. And if both of them have it, then they have a 75% chance of inheriting it. The genetic defect can be passed from parent to child. It is in about 80% of the cases. The chondroplasia is results from spontaneous mutation that occurs in the developing embryo. So 1 out of 5 cases are hereditary, the other four are spontaneous. Caused by mutation in the FGFR3 receptor gene, which is the fibroblast growth factor receptor. This protein begins to function abnormally, which slows down the growth of bone in the cartilage and the growth plate. What's available to diagnose the risk? There's prenatal ultrasound, which shows excessive amniotic fluid around the fetus. DNA testing, which can confirm fetal ultrasound findings for parents who are at higher risk of having a child with achondroplasia. There's also physical examination after birth, where a doctor can examine the infant for an increased head size and short stature and other features. There's also x-rays that can reveal it in newborns by showing abnormalities in long bones. Who is most likely to develop achondroplasia is children of fathers over 50 years old. This is a risk because as the father's age increases, there's an estimated 1 in 1,875 children who are born with this condition. Children of parents with it, obviously, their child has a 50% chance of both of them, 50% chance, and then 25% chance of it being a stillbirth. And people in certain regions also, with some research suggesting that it's most common in certain parts of the world, such as North Africa, the sub-Saharan Africa, and the Middle East. And due to the lack of technology and efficient medical care in rural areas, it varies. So the true prevalence of achondroplasia varies widely. The estimates vary widely. So symptoms of achondroplasia is the trident hands, which is the ring finger and the middle finger do not touch. They're almost like they're like this, or like in a V. They also have a flat bone and their faces are flat, which it's called frontal bossing. They have a flattened nose bridge and they may have the narrow foramen magna, which is the narrowing of the spinal canal. They also have spinal lordosis, which is curvature of the spine. They have various like deformities that could be bow-legged or just, I mean, their bones are already deformed just by the length. Also, the short statue is the way that everybody kind of recognizes. It's the disproportionate statue, which is the most common. So again, what body parts does it affect? They are shortened like The bones are shortened, thighs, upper arms. Male's average height is 4 feet 4 inches. Female's average height is 4 feet 1 inches. Their enlarged head with frontal bossing. Their fingers are in the trident-like appearance, bow-legged. The spinal lordosis causes a permanent sway of the lower back. If it doesn't need to be corrected with surgery, they probably won't. The small vertebrae canals can also lead to the spinal cord compression in adolescence, and it can also lead to delayed developmental milestones. So walking may occur in 18 to 24 months instead of the usual like 12 months to a year or less. Here's some pictures of a baby with dwarfism, and you can see the spinal lordosis and the trident hands here. So what symptoms may occur? Back and leg pain due to of many complications. Their malalignment of their legs may cause arthritis. It can be fixed with surgery. There's also spinal stenosis. The spine bone or the vertebrae is formed in a way where there's less room, which leads to compression of spinal cord, causing pain, tingling, and weakness in the legs that can make walking difficult. Neurological impairment is caused by compression created as children grow faster than their bones. So arrested bone growth is at the base of the skull, and the spine can cause the spinal cord and brainstem to become compressed. So severity usually increases further down the spine towards the lower back, and it must be treated with surgery to decompress. And then these are some famous. Okay. And then if the bones that join the head and neck do not compress the brainstem or upper spinal canal, then the life expectancy is near normal. There's also some breathing problems that may occur, which is sleep apnea. The thoracic bone deformities can lead to restrictive lung disease, which is not allowing the lungs to expand the way that they should. Their short cranial phase and mid-phase hypoplasia may also obstruct their upper airways, causing obstructive sleep apnea. Hypotopnia, which is a low muscle tone of airway muscles, may also cause central sleep apnea, which is when your what's it called? Your brainstem is compressed. So obesity also is a problem that may occur. Abdominal obesity is common, but the causes are unknown. Most individuals can go on to live a full and healthy life as long as they continuously do checkups with their doctor. So, of course, management would be weight management for any excessive weight that they might carry or put on. There also is surgery with the ventricular peritoneal shunt, which is to decrease fluid pressure on your brain or to correct the life-threatening complication called hydrocephalus, which is excessive fluid around the brain, which sometimes happens with their enlarged head. Growth hormones can also be given. CPAP, which is continuous positive airway pressure, could be used, which is positive pressure going into your lungs, which helps open up the lungs. Research is also being done on medications that may help increase height by a few inches. And limb lengthening is currently being offered to patients with complications. So lower extremity deformities cause pain and difficulty, which cause a degenerative joint disease. So it's personal decision if the individual would like to partake in the treatment that would extend their limbs. So for some patients, for women, they can achieve a maximum of 5 feet, and for boys, it might be 5 feet to total 4 inches. There is the International Center of Limb Lengthening Pediatrics Orthopedics Physicians and partner with Pediatric Endocrinology Division at the Herman and Walter Samuelson's Children's Hospital at Sinai. And they offer this program where they start at a young age, once they start growing at like puberty age, like 10 to 12 years old, up until when they're 16. And they continue to lengthen their limbs with Here's pictures with spinal rods and with basically rods inside of their legs to lengthen. And they're also outside to stabilize the legs. So as you can see, there's multiple stages to this. So it's not just a quick thing. It's multiple years. So this one was 10 to 12 years, 8 to 10 years old, 13 to 15 years old, 15 to 16, 13 to 15, same as well. And then here's another one. This is stage 2, where they are obviously almost at the end of their growth spurt. And at 16 to 18 years old, you can see that they've grown substantially. And before surgery, this was their legs, and now this is how they are now. And here is a woman who is actually a patient there, and you can see the scars on her legs. But you can also see on her x-rays that her legs and her bones look nothing like the ones before, where they're all bow-legged and sideways. And here are my references.